Thanks, Sam. Well, this week is National Patient Experience Week, celebrating the countless healthcare staff who contribute to making patient interactions as positive as they can be. And this year was challenging, to say the least. Here to talk about the ways patient experience impacts overall wellness, Laura Bailey, Regional Vice President of Patient Care Services of the Hartford Region at Hartford HealthCare. Thank you for being with us.
Oh, thank you so much, Lisa, for having me.
So when does the patient experience start?
Well, I would say the patient experience starts with our relationship with our community, which begins well before somebody might require care in one of our hospitals. So bringing care to the community is a priority for us, and every positive interaction that we have with patients in the community in those spaces builds that trust. And I would say it also starts with each and every one of our team members being committed to providing the best possible experience.
All right, tell us about some of the challenges in patient experience during COVID and how Hartford HealthCare has adapted in the interests of their patients.
So yeah, there was many challenges. We were very fortunate to be able to leverage the many strengths within our system to quickly respond to the pandemic. So we did that through setting up testing sites and then, vaccine sites, and then also using telehealth strategies so that patients can still stay connected. Probably the most difficult thing was navigating the changes to our visitor policy when our patients and our families couldn't be together. And so what we did is we really leveraged technology to kind of keep the lines of communication open, using iPads, using FaceTime. That was really a priority for us.
Nice. All right, what are some of the goals when it comes to patient experience?
Well, we really want our patients to trust Hartford HealthCare and to be engaged as partners in their care. Our goals include engaging patients in a way that sets them up for optimal outcomes, elevating the voice of the patient, and demonstrating that every moment matters. Patients should know that when they're here with us, anywhere in the continuum of care, we're acting in their best interest and using our core values.
And Laura, can you talk about how patient experience can influence medical outcomes? That's interesting.
Well, I think it goes back, Lisa, to the trust that I mentioned earlier. Patients that trust the individuals that are caring for them are more likely to adhere to their treatment regimen. They feel better overall, they have fewer complaints, and they have a better quality of life. So we really strive to elevate the voice of the patient and empowering the patient to be an active participant in the healing process. We genuinely believe that it's a privilege to care for our patients, and we appreciate them entrusting us with their care.
Quick last question. Tell us about some feedback maybe you've received from patients.
We've experienced a wide range of feedback. They're incredibly grateful for all the care that we've provided during this time. We've had people come back that have been patients in the beginning of the pandemic that have come back to thank our teams, and they're just very appreciative of the care during this time.
Laura Bailey, keep up the good work. Thanks for joining us.
Oh, thanks for having me.
Thank you.